You're welcome to my channel once again. Today I'll be addressing apnea test. For you to enjoy this fully, please kindly check my channel for Lazarus syndrome, brain death, locked-in syndrome, and vegetative state. What is the goal of apnea test? It is to increase CO2 and watch out for spontaneous respiration. It is a key process, or we can say is a confirmatory test to determine brain death. It is the last test after all other conditions must have been ruled out and all other tests must have been done when it comes to determination of brain death. Like I said in the introduction, please review Lazarus syndrome, locked-in syndrome, vegetative state, and brain death, all published right here. Before we reach the level of having confirmatory tests, we have to do certain things. First of all, what is the cause of brain death in this individual or causes of brain death here? Then, who is going to make that determination that there's brain death already? And of course, do we have good support for the family members, the substitute decision maker, and the loved ones of this affected individual? And what is the path to organ donation? Do we have the team? And are we involving the family already? We need certain things when it comes to this test. The patient, needless to say, of course. Oxygen delivery tubes and oxygen. And tidal or transcutaneous CO2 monitor that must be available. And of course, the patient is already on mechanical ventilator. There should be a cannula that will go through the endotracheal tube. TPs or CPAP, they are available. Let's review all the investigations done before now. The laboratory reports, the radiological reports, full neuro already done. Be sure no brainstem function or functions right now, no cerebral function or functions. Then the apnea test will be done right now to confirm that this individual is truly brain dead, which is brain death. The personnel that might be useful here are pulmonologists, respiratory therapists, family physicians, nurses, lab technicians, and other personnel as your department or the protocol in your jurisdiction will determine. Nothing is rigid here anyway. This test should be safe, should be accurate, should be reliable, and we have to inform the substitute decision maker or family members from the onset so that the outcome could be acceptable to them. The test is expected to establish the absence of respiratory control by the brainstem in the face of physiological stimulus to have spontaneous breathing. You can create the stimulus. Don't worry, in the course of this presentation, we'll get there. But get the baseline CO2 level and note the increase by 20 millimeters of mercury. Check the pH, which will be acidic, giving us respiratory acidosis. There are certain precautions when it comes to apnea test, and these precautions must be taken before, during, and after the procedures. Vital signs must all be checked. Arterial blood gases must all be taken. Exit CO2 level, EKG, and of course oxygen. Still on precautions, because you can't be too cautious. Give procedural pre-oxygenation with 100% oxygen. That will prevent apausia while the test lasted. You can use smaller cannula compared to the diameter of your endotracheal tube. And why that? To prevent air trapping. Out of precautions will include arterial blood gas baseline. Then make sure that the blood pressure is within normal range. Check the temperature so that you're not dealing with hypothermia. Check the fluid status and make sure this is not the patient already diagnosed with chronic obstructive pulmonary disease, because that could hinder true diagnosis here. Patient is not obese, please establish that. No neuromuscular disease or diseases, please establish that. And be sure this patient is not on any neuromuscular depressant. Also, no central nervous system depressants. Now, the procedure. Discontinue the ventilator, then your cannula into the endotracheal tube. Stop at the level of the carina. Give oxygen 100%, 6 liters per minute, or you can use TPs to provide 100% oxygen at a flow rate of 12 liters per minute, or a 10 centimeter water CPAP. The valve should be attached to the TP's extension meant to facilitate oxygen delivery. Watch to see that CO2 has risen above 60 millimeters of mercury. You may choose to reduce ventilation setting to allow for CO2 to rise to 60 millimeters of mercury. With apnea, CO2 is expected to rise at the rate of 3 to 4 millimeters of mercury per minute under normal physiological condition. Then, start observing for respiration. You can observe for 8 to 10 minutes or 15 minutes if you don't want to repeat the test. It is a must to monitor patient continuously. So we have to check for the chest movement along with abdominal movement, and for gas or mist, and we auscultate for breath sounds. We have to stop the test if the BP is dropping. So in the phase of hypotension, cancel the test. When there is severe hypoxia, cancel the test. When the EKG is showing arrhythmia, stop the test, please. If there is no spontaneous respiration, check the arterial blood gas after at least 8 to 10 minutes. Apnea test will be deemed to be positive when CO2 is 20 millimeters of mercury above the baseline, or CO2 is at least greater than 60 millimeters of mercury and the pH is less than 7.28, or there is no spontaneous respiration after you've done all this. Then you can say that brainstem is no longer in control of the respiratory system. So this patient is brain dead, and you can say brain death on the certificate. If you're not sure, you can have a repeat one more time, if need be for that, or just to be pretty sure, because it's a difficult diagnosis to make, and you look at the faces of the loved ones of this man or woman to tell them that their person is brain dead. There are a lot of drawbacks. This is not acceptable by many, even to this very moment. Many just don't like it. There are complications of apnea test, and that will include hypoxemia, hypotension, on account of which you stop the test anyway, acidosis, hypercapnia, increased intracranial pressure, pulmonary hypertension. Other complications include cardiac arrhythmias, on account of which you stop the test, cardiac arrest, pneumomediastinum, pneumothorax, burns from the oxygen, and pneumoperitoneum. And with that, I've come to the end of this very presentation. Apnea test is the confirmatory test to determine that an individual is brain dead and write that he or she is having brain death. It's a difficult thing to do. It's a difficult diagnosis to declare to the family members, but it is necessary for the purpose of organ donation and to be able to end life support when it has occurred. And apnea test has remained the confirmatory test after laboratory and radiological test. So you can check through Lazarus syndrome, vegetative state, locked-in syndrome, brain death, and now apnea test. Thanks for listening. Remember to share, remember to subscribe. I appreciate it.